It's Defender Wayne Kwong here with Defender Luca Cindolo. And now we have released today the International Bladder Prostate Symptom Score.
Yeah.
And you actually have been trying it
in
Italy. Tell us, what was it like using the form? Where's the value?
Yes, first of all, we translated it in Italian because language is important and we should share this among patients. So the first was a good translation. The second, we start administering during the consultation to the patient, and we discovered something very interesting. The patients are happy to reply, for example, on the question about sex. Of course, during consultation, we can ask about erections and ejaculatory dysfunction, but to have a clear question that you have to reply is something that asks you something more deep, and this is important. The second question, the second argument is very important to have a question about incontinence, because unfortunately the old IBPSS, a good instrument, has not question about incontinence. Okay, urgency is important, it's a storage symptom, but have also some drops of urine lost is important. If you catch this information, you are in the stage more advanced in your disease. So this is another brilliant idea. And finally, the third part, more important, is the presence of clearly stated stage of the disease. So the patient could also do auto-diagnosis, because he can also fill the form, but identify in what stage he is located. And this is create a lot of consciousness.
It's self-awareness.
Yes. This is very important because creating to the patient consciousness and awareness about their condition. And they motivated to the treatment. So, come on, it's definitely something useful. Of course, we need to validate. For the instance, we try and understand if this is better than the old one. But in the future, we can also work on.
And realize this is just a communication tool at this time. We look to the academic brigade. This just starts a conversation that introduces bladder health and sexual health, which we think are strong motivators for men to take action, to take off their armor, and to do something about their symptoms, because it's not okay to live like that. And get the data, choose data over drugs, so that we can triage patients, get baselines, and de-obstruct at the right time within the window of curability. And I think that's where we're going. It's just a conversation. Just try it. Try it 5, 10 patients and report back on LinkedIn so that we all can learn together.
Yes, from Orlando.
We're wearing. We'll see you soon.
Bye-bye.